Welcome to another episode of Med Madness podcast. Today we're diving into a crucial topic, the visual assessment of melanoma and the various skin changes that can occur during pregnancy. It's essential to understand how to differentiate between benign and pathologic changes, ensuring we provide the best care for our patients. First, let's talk about the visual assessment of melanoma. We rely on the ABCDE criteria to identify suspicious lesions. Asymmetry is a key factor where one half of the lesion doesn't match the other. Border irregularity is another sign with edges that are notched or blurred. Color variation within a lesion or compared to other lesions also raises a red flag. Diameter is important too, with lesions greater than 6 millimeters warranting closer inspection. Finally, evolving appearance over time is critical, as any change in a lesion's size, shape or color can be concerning. In addition to the ABCDE criteria, we also use the 7-point checklist to evaluate lesions. Major criteria include any changes in size, shape or color, while minor criteria look at factors like size greater than 7 millimeters, local inflammation, crusting or bleeding, and sensory symptoms like itching or tenderness. If a lesion meets one major or 3 minor criteria, it's considered suspicious and needs further evaluation. The ugly duckling sign is another useful tool. This involves identifying a lesion that looks significantly different from the patient's other nevi. If one lesion stands out as unusual, it's essential to investigate further. Now let's shift our focus to skin changes during pregnancy. Pregnancy induces multiple changes in the skin, hair and nails due to fluctuations in estrogen and progesterone. Most of these changes are benign and reversible, but pathologic changes can also occur, so all changing skin lesions should be assessed for possible malignancy. One common benign condition during pregnancy is melasma, characterized by centrofacial hyperpigmentation that spares the nasolabial folds. This is likely induced by estrogen and progesterone effects on melanocytes, causing increased melanin accumulation. It typically fades postpartum, although some hyperpigmentation may persist. Polymorphic eruption of pregnancy, also known as pruritic urticarial papules and plaques of pregnancy, PUPP, may be triggered by the skin stretching over the enlarging gravid uterus, causing inflammation and pruritus within abdominal striae. This is a benign, self-limited condition that resolves postpartum. Increased upper lip hair in pregnancy is due to increased circulating androgens, causing thickened terminal hair growth. Scalp hair spends more time in the anagen growth phase, leading to decreased hair loss. Hair loss can occur postpartum due to a large proportion of hair in the resting telogen phase, known as telogen effluvium, but the terminal hairs may be permanent. Spider angiomas are benign erythematous lesions that blanch with pressure, frequently occurring in pregnancy due to increased estrogen levels causing increased blood vessel vascularity. They typically resolve postpartum. However, not all skin changes in pregnancy are benign. Intrahepatic cholestasis of pregnancy, ICP, typically occurs during the 3rd trimester and is likely due to increased estrogen and progesterone causing hepatobiliary tract stasis and decreased bile excretion. This results in elevated total bile acids, which can cause generalized intractable pruritus that is worse on the palms and soles. Some patients may experience right upper quadrant pain and elevated aminotransferases. ICP increases the risk of fetal complications, so management includes treating maternal pruritus with ursodeoxycholic acid and regular fetal assessment, with delivery planned at 37 weeks gestation. When assessing changing skin lesions in pregnancy, indications for biopsy include color variation within a lesion, change in shape, asymmetry, size, or border irregularity. Let's consider a real-life case study to illustrate these points. A 32-year-old woman, 28 weeks pregnant, presents with a new variegated nevus on her back that is distinctly different from her other melanocytic nevi. This lesion, showing the ugly duckling sign, has irregular borders and different colors within it, prompting concern for melanoma. Additionally, she has developed symmetric, irregularly shaped hyperpigmented macules on her face, typical of melasma. While the melasma can be managed with sun avoidance and broad-spectrum sunscreen, the nevus requires a biopsy due to its suspicious characteristics. Her case also highlights the importance of distinguishing between benign conditions like melasma and potentially serious changes like melanoma. In conclusion, understanding the visual assessment of melanoma and the various skin changes in pregnancy is essential for timely and accurate diagnosis. Whether it's recognizing the ABCDE criteria or managing benign conditions like melasma, being vigilant about changes in the skin can significantly impact patient outcomes. Thank you for tuning in to Med Madness podcast. Stay informed, stay vigilant, and take care.